How do you know if your mom or dad is ready to come home from the hospital? So if you haven't watched before, my name is Dr. Nicole Diddick. I'm a geriatrician, so I'm an internist who looks after older adults. And my practice is mostly doing consultations. So I'm not a primary care provider, but I see people in consultation for other doctors. I do get asked by a lot of doctors who work in hospitals to see patients who have been admitted. And most of the time, the ones they ask me to see are older. And the question is quite often, can they go home? And you know, sometimes it's a bit of a mystery to me why the rest of the team can't sort of make the decision on that. But you know what? It can be complex. The decision about whether or not an older adult is ready to go home often touches on many things that we've talked about here before on The Wrinkle. It touches on living with risk, frailty, capacity, and the hazards of being in hospital. So oftentimes making a decision about whether or not to go home isn't black and white. It can be full of nuances, but most of the time it's a matter of figuring out what risks the person might be exposed to by leaving hospital and balancing that against the risks of staying in hospital. Often we do have to assess the person's capacity, so get a sense of what the person's understanding is of what their risks and benefits are and what their choices are. Almost always we want the person who is in hospital to make that decision for themselves whenever possible. So let's talk a little bit about living with risk. We're all living with risk, but in older adults, we can be pretty uncomfortable sometimes about letting an older adult choose to live with risk. So an example might be if an older adult has had some falls. That might even be the thing that led the person to come into hospital. And you know, a lot of the risk factors for falling are things we can't correct. So that person is going to continue to be at risk for falls. But does that mean that they can't go home? Does that mean that they have to go to a long-term care home so that there's somebody around to remind them that they need to use their walker or their wheelchair? Well, it's important to think about that because people can fall in long-term care homes. People can fall anywhere. And as I said, some of those risk factors for falls aren't things that we can change. Sometimes it's just a matter of identifying those risks and doing sensible things to try to reduce them. So that might mean having an occupational therapist go into the home to try to remove some common tripping hazards. It might mean making sure that the person has the correct walker for them. So whatever practical things we can do to reduce the risk, we will. But sometimes we let people live with risk, even though it can make some of us uncomfortable. Another question that comes up is capacity, and that's a complex issue. But for my part, when there's a question of whether or not someone can decide if they can go home or not, we almost always try to err on the side of the person making that decision for themselves. It's pretty difficult to find that someone's not capable to make that decision. And there's a whole process that we go through whereby sometimes the person can actually challenge that assumption. And then we have to have a hearing to actually see if the person is capable or not. Those hearings can be really painful. I've had to attend them before, and it usually involves sort of sitting there and pointing out all of the challenges that the person has had. It can do a number on their self-esteem. So sometimes capacity issues come up, and most of the time we try to do our best to make sure that a person is capable if they are at all. We try to err on the side of saying that they are capable. If they're not capable, then it's really important that we find out what were their wishes before they became incapable. Maybe their substitute decision maker can decide on their behalf what they would have wanted anyway. So then the capacity issue isn't as important. The other thing that comes up is frailty. People who are frail, almost by definition, have difficulty with the day-to-day function. And so making a decision about whether or not to go home from hospital usually involves looking at what the person's function is and what it needs to be like to go home. So if a person is going home with a partner as well as some caregivers and other family members who can pitch in, well, then maybe they could have a lower functional level, and there are other people and things in place to accommodate for that. But for other people, they need to have a higher functional level because they live all by themselves and might just have a personal support worker coming in for 10 minutes in the morning. Those kinds of practical issues are things that usually it doesn't take a geriatrician to figure out. Oftentimes an occupational therapist, physiotherapist, social worker can gather all of that information. It's really helpful to identify those gaps and then try to problem solve with the team on what we could do to fill them when the person does leave hospital. People who are frail, though, remember, they're vulnerable. So even when we put in all those safeguards, they're probably still going to be living with risk and have some risk of coming back to the hospital. No discharge plan is perfect. And finally, being in hospital can seem like a safe haven. There's a lot of people around, and usually in hospital, people do get really good care. So a lot of people are reluctant to leave the hospital. But remember, there are hazards associated with being in hospital. Just being in hospital increases the risk of infection, like urinary tract infection or pneumonia. There are sick people in hospitals, so there you're more likely to get an infection or a super bug, which is a type of bacteria that is kind of resistant to antibiotics. And those can be serious and complicated to treat. Being in hospital can increase the risk of delirium, which is a sudden change in thinking and alertness. It can be associated with hallucinations, and it can be very dangerous. Some people die as a result of delirium. So although the hospital can seem like a safe haven, it's usually a good idea if seniors can avoid being admitted in the first place and then be discharged home as soon as possible. Sometimes that's a part of my job to kind of talk to families and patients about that, because sometimes that's a gap in the person's understanding of what can happen in hospitals. And finally, frailty is a complex syndrome. Remember, it's a state where people are increasingly vulnerable to even minor challenges or perturbations. People who are frail may be readmitted to hospital. They may need specialized resources to try to stay out of hospital, and they may benefit from having their goals kind of reframed from the traditional goals of treating, investigating, and curing everything to maybe just trying to minimize suffering and support the person's other non-medical goals. So this week when I'm on call, I'm sure I'll be asked quite a bit about whether or not someone can go home, and I hope I've given you some insight into what the decision-making process involves. Thanks for watching, and if you want to learn more, please go to www.thewrinkle.ca.